In general, the American diet is not a healthy one. We take in too many calories, we take in too many fats and too many carbohydrates. This puts us at risk for becoming obese, and obesity leads to other medical problems like high blood pressure, diabetes, high cholesterol, and sleep apnea. All of these are risk factors for heart disease, for hardening of the arteries, which is known as atherosclerosis. Because of this, obese patients are more prone to having a catastrophic event happen in the future, such as a heart attack or a stroke. Most patients who are contemplating bariatric surgery should modify their diet before the operation. This should continue afterwards. The diet should be lower in carbohydrates, lower in fats, higher in protein, and higher in fiber. We would like to reduce the total number of calories patients are taking in. After all, that is the main point of having an operation. For males, we'd like to stay under 2,000 calories a day. For females, we'd like to stay under 1,800 calories a day. It is essential that patients teach themselves to manage the number of calories that they're taking in. Of course, knowing what you're putting in requires that patients look at labels. Learning to read food labels is essential to the overall process. Within the allowable number of calories a patient is going to take in after surgery, we would like to emphasize certain things and we'd like to reduce others. When it comes to fats, we'd like to decrease the percentage of saturated fat that the patient's taking in. The American Heart Association recommends 7 grams of saturated fat or less a day. This is not very much. Healthier forms of fats include polyunsaturated fats and fish oils. When it comes to carbohydrates, we're really talking about 2 different groups. Simple sugars and high fructose corn syrup are very dense forms of calories. They should be avoided as much as possible. More complex carbohydrates such as vegetables and fruits are to be encouraged. Patients should take 2 to 2.5 cup servings of each of these a day. However, within the group of starches, some foods are better than others. There is something known as the glycemic index. The glycemic index is a measurement of the body's response with blood sugar to intake of different types of foods. For example, if you take in the same amount of potatoes as you take in of green beans, the blood sugar will rise much faster with the potatoes than with the green beans. The body's response to a higher glycemic meal is to produce more insulin. Insulin can rise and fall more dramatically, and this leads to rebound hunger and other problems. Therefore, lower glycemic index foods are a better choice. After surgery, we're going to decrease the total amount of carbohydrate and the total amount of fat that the patient is taking in. We would like to keep the protein level the same, however. Proteins are essential to many bodily functions. Foods that are rich in protein include lean meat, fish, low-fat dairy products such as low-fat milk or low-fat cottage cheese, egg whites, and some vegetables including beans, whole grains, and nuts. These foods should be emphasized after bariatric surgery. Although fiber doesn't have much to do with weight loss, it is essential for overall health. Water-insoluble fiber is important for bowel function, and water-soluble fiber actually binds certain things in the intestine that can lead to a lower overall cholesterol in the bloodstream. In general, patients should take a lower carbohydrate, lower fat, higher fiber, and higher protein diet after an operation.